Encik Wan Muhammad Ihsan bin Wanawi. Okay, let me introduce him a bit. Okay. Encik Ihsan is working in physiotherapy department as a physiotherapist in Hospital Putrajaya. Okay. And he was graduated with a Bachelor of Physiotherapy Honours from UITM and completed his Master in Clinical Exercise Sciences from the University Science Malaysia in 2020. Okay. In his early career, he worked at Damansara Sports Medicine and Rehab Therapy and also at the National Sports Institute. Okay, he joined the Ministry of Health in 2013 and currently he is a physiotherapist working at Hospital Putrajaya. And he is responsible to conduct a few non-communicable disease programs which include weight management for obesity in children and exercise program for people with arthritis. And besides, he is also actively involved at Ministry of Health in designing and implementing training modules for physiotherapy management in obesity, hypertension, as well as diabetes. In 2016 and 2018, he was invited as a physiotherapist for Wilayah Persekutuan contingent competing in SUKMA or Sukan Malaysia, which were held in Sarawak and also in Perak. On top of that, he was selected as a physiotherapist when Malaysia hosted an international sport event, which is a SEA Games in 2017. Okay, without further delay, I invite Mr. Wan Muhammad Ihsan bin Wanawi to deliver his presentation on exercise prescription for hypertension. Okay, so please welcome on board, Mr. Wan Muhammad Ihsan.
Okay, thank you, Dr. Zarina. Can you hear my voice?
Yes, we do.
Yeah, okay. Assalamualaikum and good afternoon. First of all, thank you for inviting me for these sessions. And today, I'm going to share with you about exercise prescription for hypertension. Okay, here. Can you see the slide?
Yes.
Okay. So I choose this topic because some of us, even my colleagues also, they lack of confidence in treating a patient that having a hypertension. So here I want to share a bit about designing an exercise for hypertension. Okay, here first the prevalence of hypertension. It is hypertension, and WHO estimate that in year 2025, near to 29.2% of world citizens having hypertension. And in Malaysia, the case of hypertension increased from 2006 to 2015 for 0.7%, from 34.6% to 35.3%, which is increased year by year. And the hypertension cases is very high among a person that having BMI more than 30, which is a more obese, and includes underlying chronic diseases such as diabetes, excess cholesterol level, and abdominal. And Last one is in the rural area compared to urban. Okay, hypertension is when the systolic blood pressure is more than 140 millimercury, and or the diastolic blood pressure is more than 90 millimercury. And blood pressure is defined by the force exerted to the artery wall during the heart contraction. And for to someone that we classify having a hypertension, we need to measure it for 2 times or more occasion. And someone that taking the hypertensive medicine. Okay, this is a stage of hypertension, which is stage 1 is 140 per 90, and then stage 2 is 160 systolic blood pressure, and 110. Okay, I'll go a bit faster. This one is the normal blood pressure within 130, and systolic blood pressure, and 80 the sleep blood pressure. So physiology changes. How is BP measured is when the cardiac output time with the peripheral resistance, which is when the peripheral resistance increase, the blood pressure will increase. Okay, and this is a sign and symptom of the hypertension. Namanya dizziness, recurrent headache, nosebleeds, irregular heartbeat, vision problem, and fainting. So I go a bit fast on this part. So a complication of hypertension is heart failure, normally the left ventricle hypertrophy, stroke because of high kidney disease, blur vision, and sexual dysfunction. Okay, this one is classification of the hypertension. Okay, we have a non-modifiable and modifiable. So non-modifiable is about our genetic, age, and ethnic. For modifiable is high salt intake, which is when the sodium high in our body, it causes water retention and increase the volume of fluid in the body. This can cause the hypertension. A low potassium in intake. Low potassium is a function to vasodilate the blood vessel, and when the low potassium, it can affect the elasticity of the blood vessel. And the obesity, of course, fat accumulation, sedentary lifestyle. Sedentary lifestyle is time on sitting, lying in the stress also can cause hypertension, of course, right? Insulin resistant and low calcium. Low calcium also, it can cause the what we call vasoconstriction to the blood vessel. Okay, this one is a secondary of hypertension. A bit faster on here. Etiology. All right. So etiology, causes of the hypertension is excess sodium intake, reduce nephron number, stress, genetic alternation, obesity. And all of these cause the structural hypertrophy, functional contraction, and it will increase the peripheral resistance, so that it causes hypertension. This pathophysiology also, it causes the increase of peripheral resistance and cause the hypertension. Here, mentioned previous. So this is a blood vessel. We need to know the anatomy of the blood vessel, which is we have the 3 layer. Tunica adventitia is the outside. Tunica media is the middle one, and the tunica intima is the inside. Okay, this is atherosclerosis, when the fat deposition in the artery. Normally, injured to the blood vessel because of the hypertension. So when the lesion occur in the blood vessel, it can easily cause the fat deposit at the blood vessel. So day by day, it will increase, it will larger and cause the blocking to the blood vessel. All right, here can see day by day, the blood vessel reduce in size. So when the peripheral resistance increase, so our heart need to pump harder in order to supply the oxygen to the organ, so that it can cause the hypertrophy to the left ventricle. Okay. All of this occur because of the metabolic imbalance. Metabolic is what we call the way our body utilize the energy source. For example, the glucose, the protein, the fat. So when you cannot utilize the energy sources, it can cause fat deposition to the blood vessel. And when the glucose is higher in the blood vessel, it's the particle will normally is the disturbing attack the nitric oxide, which is very important in dilate the blood vessel. So when the glucose increase, it will attack nitric oxide. Nitric oxide will reduce in number, so it cannot help to dilate the blood vessel. Okay, do you understand? So far, okay? Here we need to understand the metabolic imbalance, the way how we utilize the energy source. Okay. In order to overcome the imbalance, primary aim of the treatment of metabolic imbalance is to treat the modifiable risk, which is we know previously obesity, right? And what we call glucose, sodium intake, and underlying risk factor. Changes. Obesity, which is fat or abnormal fat accumulation in the body. So physical inactivity is SCSM. They define it as when we cannot fulfill the requirement by WHO to exercise 150 minutes per week. And heterogenic diet is consists of high salt, saturated fat, or the bad diet lah. And the guideline to reduce weight by 7 to 10% of the first year therapy with the goal of to achieve 25 BMI 25, which is normal range for BMI is 18.5 to 25. But for the Asian country, we reduce it to 18.5 to 20. Okay. Yeah, hypertension is closely correlated with the excess body weight. And you can see that reduction of blood pressure in average of 5.1 kg is about 4.4 and 3.6 mmHg, can lower the blood pressure. So it's very important to lower the weight. And in order to lower the weight, we need to have a calorie their deficit for about 500 calories per day, which is when we accumulate it for the 7 days in a week is about 3,500 calories. 3,500 calories, we can lower our weight for about 1 point or 0. We can lower it for about 1 to 2 kg. Okay. Okay, this is a physical activity. This one is based on the steps by day. 5,000 steps, sedentary lifestyle, low active, and physical activity with 7,500 and above. So this one is a general recommendation by the SESM, which is we need to do exercise per day, 30 minutes per day for 5 days per week for a total of 150 minutes per week. And a vigorous intensity of cardiorespiratory exercise training for 20 minutes per day on 3 days per week, which is about 75 minutes per week. Okay. But do we know about are we exercise in correct way or effective way? Here is who is here perform exercise 3 to 5 days a week? Anybody here? Exercise 3 to 5 days a week? Okay. And 3 days? 2 days? And did you know that if you perform 3 to 5 days, did you know that the exercise is effective for you? How do you know it's effective for you? How do you know the exercise is effective? More stamina, change. And do you train? Do you have any indicators such as what you call the watch that we can monitor the heart rate? Do you use it during the exercise so that we know the target heart rate during exercise? Or you just do puppet at the radial artery? Okay, here I will explain a bit about the energy that we burn from the exercise in the daily activity, and I will explain about the exercise compendium, which is very important in design the exercise and calorie calculation and heart rate transmission, so that we know that we perform exercise effectively and safe. Okay, so here you can see the metabolic equation task, which is the ratio of rate at which person expend energy relative to the mass. Okay, here if we cycle BMX, the metabolic equation task is 8.5, which is high intensity. Okay, here I will share with you the okay. This is the exercise compendium. You can download from the internet. Okay, here you can. All right. Okay. So here you can know by bicycle general the max is 7.5, leisure is 3.5. So I will show you here. Here is a metabolic equation just now. I mentioned the max is below than 3 is light intensity. 3 to 3 to 6 is moderate, and more than 6 is vigorous activity. So here we can see here all the meds, and then the RPE. We also need to know the RPE in case a person that do exercise taking beta blockers or something drug that may affect the heartbeat of the heartbeat. Yes, and when they taking the beta blocker, the reading of the heart rate is not accurate because it's affected by the drugs. So we can use the RPE score to classify the intensity of the exercise, which is we can from the 12 to 16, 17 and above. RPE scale here. Familiar or not? Okay, next. Go. So heart rate training zone, which is very important to know if we use the heart rate reserve, the intensity, low intensity is between 20 to 39% of the heart rate reserve, moderate 40 to 59, and vigorous is 60 to 84%. If we calculate from the heart rate max, the low intensity is from the 50 to 63, moderate 64 to 76, and 77 to 93. Okay, here we get the way the formula, the equation for the maximum heart rate. We just 220 minus our age, and from the value we get there, just multiply the heart rate reserve maximum heart rate because it's included in heart rate here. Here so we can by resting heart rate also is an indicator to know that we fit or not. Okay, next. Okay, here is the calorie calculation. So you can know that we perform our exercise in effective way or not. So here you can see just now the exercise compendium, the code here. Sorry, this is the code, the math, and the type of the exercise. Okay, here code, math. This one 3.5 is the formula. And weight, we need to put a weight and duration of the exercise. So here is the formula. Weight times 30 and divide by 200. So we can get by cycling for 30 minutes, you can get the 367 of calorie burns by doing cycling. And warm up, weight training. So just change here and change the weight duration. So in a day you can burn 611 calorie per day, which is our target just now I mentioned previous is 500 calorie a day. So it's enough, is it? To burn calorie. So this is what for the one day. So in order to reduce the weight for 1 pound, we need to burn 3,500 calories at the end of. So far, okay, do you understand about the how to what we call the calculate the calories. Okay, right. Next is, okay, this is a cardiorespiratory exercise. In hypertension, most of the articles show that cardiorespiratory exercise is very important in order to lower down the blood pressure or to normalize the blood pressure. So the SESM suggests us to do 30 minutes in a session, is it? So, but in the clinical setting, the patient can perform 30 minutes of exercise straight away. They can do 30 minutes straight away for the hypertension. If they cannot do, for example, we can do a 10 minutes and rest for about 1 to 2 minutes and continue again. And the study shows that the effect is similar with continue. We perform the 30 minutes of continuous exercise. So we can break up as long as the total time of exercise is 30 minutes. So we start with the low to moderate intensity of exercise. In hypertension, we start with low to moderate. And then after that, you can increase it. Because during the moderate intensity exercise, we use oxygen during exercise. The oxygen is helping us to burn the fat, which is very important to reduce the blood pressure. And you can use the high intensity, but it's more to utilize the carb. I'm suggesting to perform the moderate intensity exercise. And the exercise must be involved a big muscle and more muscle movement. Okay, for example, the swimming, we need to move the upper limb and lower limb. So we will use more energy, more ATP to move our muscle to contract. And the resistance training is very important in among the hypertension, because the bigger muscles, they will utilize more energy. Just I mentioned, because metabolic imbalance because of the glucose, excess glucose or fat in the blood. So by having the big muscle, the blood vessel. So moderate to vigorous is about 60 to 81 RM for resistance. And then we start with low weight and high repetition, 2 to 3 days a week, of the moderate to vigorous intensity, 2 to 4 sets, 8 to 12 repetition. Okay, here is a dynamic resistance exercise. You can perform dynamic resistance exercise, and the study shows that dynamic resistance exercise also can lower down the BP. And for the isometric resistance exercise, if there's someone that cannot perform the dynamic resistance exercise, they can choose the isometric resistance exercise, which is also can lower down the blood pressure. Okay, here. So all the strengthening exercise must based on the patient condition. YouTube and just follow the YouTube or anything else, but make sure that the patient capable to perform the exercise. Okay. Okay. So during the resistance exercise, do not continue to lift a weight when you feel exhausted. So when you feel exhausted, just stop. Okay. Because it can cause injury. And don't hold your breath during lifting because it can also increase the blood pressure. Keep breathing during performing the exercise. Okay, flexibility exercise. Just keep continue. Okay, here I want to share about the innovative way in implantation strategy for the hypertension. Here is share with me how to design an exercise for the patient that have a very low tolerance, exercise tolerance. So we can ask them to wear a windbreaker, so that when he wear a windbreaker, it can cause increase in temperature to the skin, so that our heart need to pump harder to dissipate the heat. So when the pump harder, blood vessel will increase. So it will helping the hypertension patient. And when we wear the overdressing, when we have the overdressing here also, we are easily to reach the our heart easily to reach the heart rate training zone. You try it before? Overdressing? Okay. Here is a Pacific therapy. Normally this one is the study is sure after exercise we just immerse our body in the warm water. This is to enhance the vasodilation of the blood vessel, and can even go to the sauna after exercise. This is just for the hypertension case, not for the the sport injury, which is after exercise we can apply the ice pack for the hypertension case, because we want to enhance the vasodilation of the blood vessel. So we go for the heat therapy. And here is I share you about the study done by my previous lecturer, which is a very hand anemometer to know the strength. So from the strength, we take the 30% of the total strength, and we hold it for 2 minutes and rest for 1 minute. And then we do again for about 4 sets. It's a very simple. We do about 3 times a week, and you can see a result. The blood pressure will reduce. You can try this. Do you know about this exercise? But if you don't have the dynamometer, you can use the what you call the apa tu penimbang tu, and just grip with our hand to know the strength. Okay, we just perform here that have exercise reducing exercise tolerance. Water aerobics, normally water have a lot of resistance, so you can give a resistance to the muscle. And for the obesity, which is very good to perform exercise in the hydrotherapy in the pool. Okay, special consideration during hypertension performing exercise. Among hypertension is medication. We need to ask them before the exercise. We need to ask them even whether they taking any medication, because when they taking medication, it can cause vasodilation and reduce the heart rate. So from there, we need to use it is a valid outcome measure. So that from there we can know the intensity of the exercise. RPE, we can ask the patient, we can ask the client for the leg, if they do the cycling for the leg, how much is what is the RPE score? If the client say that RPE score for the leg is 16, and we ask about the breathing, how is your breathing during the exercise, and the client say that 11, it means the intensity is a moderate intensity, and it's also indication that when the leg is the RPE score is 16, mean that the client have a weakness of the lower limb. Okay, so far do you understand? And position in cycling, our lower limb is hanging down, is it? So it can cause a blood pool to the lower limb. So we can suggest to the patient to perform the recumbent bike. Okay, cooling down to prevent hypertension, because during exercise cause vasodilation. When we immediately stop during exercise, it can cause hypotension. So we need to slowly stop the exercise. I mean, perform a cooling down exercise on the big muscle, because the big muscle can tolerate more pressure to the blood vessel. Okay, this is a safety strategy plan, which is I think the last time Mr. Naim is explained about pre-participant heart screening, is it? And okay, fitness testing, we can do a testing. This is a very important to know the baseline to design any muscular strength, cardiorespiratory, flexibility, body composition. And for the obesity, normally we need to know the fat accumulation in the body. So BMI only is not, I think it's not enough. You need to have a what we call the in-body, something like electronic measurement to measure the fat accumulation in the body. Okay, so by doing the testing, we can develop foundation. So we know the level of fitness among the clients. So we can design a program, and we need to evaluate. Here is some of the exercise testing. This is for the lower limb strength, upper limb strength. This is for power. VO2 max. Here is we need VO2 max of the person. This is lower back. Okay, so before the exercise, if the BP is 200 and 110, we just stop the exercise, or we cannot begin the exercise. Okay, here is the value of the blood pressure. We need to know before we perform any exercise among hypertension. Okay, exercise program. The concept here is we need to start low and go slow. And we need to stay alert and observe them. We just cannot just put them on the bicycle and then go to the toilet, have some go for the lunch. We need to observe them, especially when they perform during the perform the exercise. Before doing the exercise, we need to explain to him how you need to what you call tell us, immediately tell us, and we need to observe them. Normally, the patient, they didn't tell us they are really tired or cannot continue with the exercise, but we can observe them, the facial expressions. Okay, here is I will show you the exercise program. Normally the exercise program we go for 3 to 6 months, which is okay. Here I just designed a Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. Okay, so here by insert the value here, we can know for the first day we burn for about 556 calories. Second day, same value. Third day, fourth, about 3,273, which is not enough, is it? Just now we target to perform we target our deficit is 3,500, is it? But it's first to second week of the training program is more to adaptation. We don't worry much about the calorie burns, just for adaptation. Let them exercise. Okay, here we include the aerobic, cardio training, resistance trainings. If we perform the exercise training, I just put every day we need to perform the weight training. Here is don't be mistake here, because here is when we do a heavy load and the next day we can change to lighter load. So we can do that. Or we just on a Monday we can do for the upper limb. If we hold or we stop for too long, normally for if access more than 3 days, it can cause retraining to the muscle. So we need to design it properly. Okay, so after that, week 3 and 4, we can increase the duration of the exercise, intensity of the exercise. Okay, which is now we can reach the 3,900 calories per week, which is week 5 we can increase, because what we can increase more, because when they reach week 5 or 6, the weight is reduced, so they can perform more. Perform more exercise because the weight is reduced.
Cik Ihsan, maaf ganggu sekejap.
Yes.
Are you still at exercise program slide?
Yes.
Oh yeah, okay, because the participants are wondering why the slide is not moving, and you are talking about the weekly program and so on. So yeah, so we are still at the exercise program slide. Thank you.
Program.
Is it?
Exercise program slide. All right. Now you can see this one.
Yeah, it is exercise program slide.
The exercise program, you can see the Excel.
Oh, the Excel, no.
No.
Yeah. We don't see the attachment slide.
Attachment slide.
Or maybe you need to share the screen for the Excel. Yeah. Have you opened it up in your screen earlier?
Screen, yeah. This one?
It's not yet appear.
Okay. Here?
Still not yet.
Right.
Have you already opened it in your desktop?
Yes, yes, but it's loading.
Oh yeah, yeah, yeah. It takes some time. So it's lagging a bit.
Ah,
Are you okay there, Cik Ihsan?
yeah, yeah. Right. Ayun. Ah, okay.
Adik ada buka semua? Ada 4 ke 5? 5. Oh.
Cik Ihsan, are you there? Oh yeah, okay. Cik Ihsan, can you unmute your mic?
Okay. Here is the
Yeah.
exercise program for the hypertension. So we go for total of 12 weeks of program, which is week 1 to week 2 is more to adaptation for them. Just you can see here is Monday is 556 calorie burns a day. Tuesday, Wednesday, and the total of the week is about 3,273 calories per week. So which is not reach the requirement of 1 pound, but it's okay for the first and second week. We just let them exercise, and with week 3 and week 4 we can increase the duration, and you can see here the calorie burns increase from the 500 to 700 a day, and the total of the week is about 3,963. From there, we can know that you can burn for about 1 pound or 0.5 kg. And after that, we can increase the durations week by week until we reach the week 12. And the difficulties of other exercise after we can increase from the bicycle, and then week 12 we can go for the jogging on the treadmill. 638 calories a day. So here is the way we design the exercise for them. Is it okay? Do you understand how to design the exercise? It's okay to here the exercise we included the aerobic exercise and the resistance training, and we combine with the overdress. Okay, can do this. After this, you can try at your clinical setting lah. Okay.
Sorry, Encik Ihsan, for
Yeah.
interrupting for another
Yeah.
time. Okay, we just have about 7 minutes left to end the session.
Yes.
Uh,
Yeah. That's all for me from the exercise program. Sorry. Thank you.
all right, okay. Just about time. Well, thank you very much, and Ihsan, for a very fruitful sharing. Yeah. And as what we know that hypertension is a common condition and a well-known condition in our population, in our community. Yeah, that leading to some other serious complications later, like stroke and other complications. Therefore, okay, exercise, yeah, is very important to keep ourselves healthy and prevent hypertension from occurring. Okay, and as what we are, yeah, as a physiotherapist, we need to keep update on the info on the current guidelines and so on hypertension management. All right, now we move on to Q&A sessions. Yeah, I find out that there are several questions, but because we have limited time, so yeah, maybe we cannot answer all during the live session. Probably later, Ihsan can just write the answers in the chat box. Okay, now for question number 1, it comes from Norain. Okay, can you suggest any outcome measures to measure METs or METs?
MET.
Yes, MET.
MET.
Is there any outcome measures that you can suggest, yeah, for the therapists to use for MET?
MET, metabolic curve-shift, is it? So we just to here we just need to know the light intensity, moderate intensity, and vigorous intensity. Here we can know the intensity of the exercise by knowing these things. And to know that, you can look for the exercise compendium also. So here, then 6 here is it is a high vigorous intensity of the exercise. So just download the exercise compendium here. You can know the maths. Right? Or other way is by the calculation. Okay. Did I answer your questions?
I guess so.
So you can download the exercise. You just download the exercise compendium here, and you need to know the range of the metabolic equivalence, which is here. The range is until 3, 1.5 until 3 is light, 3 to 6 is moderate, and more than 6 is vigorous.
Yeah.
Okay.
Yeah. All right. Thank you for the first question. Now, the second question comes from Natila. Okay. She asked, for the tempo exercise, is it a need to hold 3 seconds or just do it with fast tempo for hypertension person to burn the calories? Tempo exercise.
Tempo of the exercise is you can even do the, just now I just mentioned previous, is isometric exercise and dynamic resistance exercise. So you can even do both of the exercise to burn the calorie, but you just cannot hold your breath during the exercise, because when you hold the breath, it can increase the blood pressure. So both of the exercise can burn calories. Yeah.
Okay. The third question: what is the purpose or need for overdressing and exercising in warmer environment to more easily reach the target heart rate with less exertion? This question comes from Afnan.
Oh, the target heart rate. I mean the overdress.
Overdressing and exercise in warmer environment.
That one is what we call the workload, mean to reduce the workload. For example, if we want to reach the target heart rate 140, we need to cycling with the resistance of 50 watts, is it? But if we have an overdress, we just need to cycle for about 25 watt to reach the target heart rate, which is 140. Because when we have the overdress, we will increase the heart rate. Heart rate will increase in order to dissipate the heat. So it is more to person that have a low exercise tolerance. Okay.
I guess that's answered the question. Okay. All right. Last one. Okay. The last one again come from Norain. Do you make a diary for every patient participating in NCD's program, which have all components like for cardio and resistance training? Do you give them the diary or anything?
Diary, yeah. They're supposed to. Normally, in our clinical setting, we just noted in the Excel just now. I write there all the exercise that we given, and for the dietary diary is the dietitian, and for the exercise program, we just insert it in the Excel.
Yeah. Yeah, I think that's answered the question.